Hi, this is Mariella Clark, and I'm here to do my skills checklist for the Ostomy Management course. Emptying the pouch appliance, taking the appliance off the skin, and reapplying, teaching. So we're going to start.
Okay.
I'm going into patient's room. She's just had ostomy surgery, and this is post-op in the hospital, and Hi, I'm here today. My name's Mariella, your ostomy nurse, to show you how to empty your pouch and take off and reapply a new appliance today. How does that sound?
Sounds good.
Okay. Now, would you like to participate in this, or would you like just to watch me today?
I would like to watch, please.
Okay. All right. Well, let me wash my hands and put some gloves on. Okay. I already have my equipment set up here. It's very important to have your equipment supplies all set up and ready to go before you start this. Okay, so I am going to kind of take a look here at your appliance. Okay, so I have one for you to look at and practice closing this up. This one is Velcro. Okay. But let's look at yours right now. Now we're going to empty this today, and it's really important to empty when it's about 1/3 to 1/2 full, because if it gets much fuller than that, then it can start pulling away from the skin. And you can do this at home by either standing next to the toilet or sitting on the toilet frontwards or backwards, whatever more comfortable for you. Now today we're just going to do a little receptacle here at the bedside, okay? So now I wear gloves, but when you're at home, you don't have to wear gloves when you're doing this yourself. So we're just going to undo the Velcro and fold it back, kind of hold this up so no drainage comes out while we're trying to do this. Open it, and then put it down into our receptacle and empty it out. Now you can just kind of push down with your fingers to get all of the stool out, coming down, okay, and kind of tipping it there on the side to clean it up. Now I always have some tissue ready to go. You're going to clean the outside. You can just throw that in here in this receptacle, and then kind of on the inside here too. And then you're going to fold this back up and close it off. There you go. Okay, let's get rid of that. Okay, so now we're going to remove your barrier and pouch. And the best thing to do is you're kind of going to start at the top and hold one hand on your barrier, kind of get it away from the skin. The other hand, you're just going to push gently on your skin as you're pulling this off. Start at the top, gentle, 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 kind of pulling that off. Now, if you need to, there are some little adhesive remover pads that we could use at the same time. I can show you all that stuff. So then you've got your pouch off. And then what you want to do is inspect the back of it and check for any erosion or any areas that might show where you might have some leakage. But yours looks pretty good, and I think we're going to be okay. Now we're going to look at your skin around your stoma and kind of gently clean it. Warm water and a cloth. Just kind of clean around the stoma. You can hold some tissue here to the opening of the stoma in case something, unless you want to come out. Now you want to empty this at a time of day when your bowel's less active, like when you first get up in the morning before you eat, or at least 2 hours after you've had a meal. Okay. Now your your pouch should have a wear time of 3 to 5 days. So that's kind of nice, unless you have some burning or itching or leakage that you feel, and then you probably should change your appliance in your pouch. Okay, So we've cleaned it. Now let's look at your skin. It looks nice and clear. If there is some redness or irritation, we can help that with some skin barrier or some stoma powder, very lightly stoma powder, followed by a little bit of skin barrier to help any skin irritation. Okay, so we're covering that. And then we also want to look at your stoma, looking at the color and the shape. Now yours is nice and round and raised and beefy red, and that's very good. So you'll want to look at that every time you change your appliance. And at first you'll be wearing a bag that's transparent or clear so it's easy to see without taking your pouch off. Now what we're going to do then is I'm going to wash my hands, change my gloves, and now we're going to measure your stoma to see, because this appliance that we're using is cut to fit, so we need to cut the opening that matches your stoma. And every bag or box of pouches comes with this stoma guide. So we're just going to go over and look. Well, that one's too big. This one's still too big. This one is too small. You want something that's going to go around the stoma, just around it. So the least amount of skin is uncovered. You don't want any skin uncovered. So it looks like your measurement is 38 millimeters or 1.5 inches. Okay, so our appliance here has 35, 40, 45 millimeters. So we're going to have to draw. I'm going to do it here so the camera can see me. We're going to have to draw a circle and mark that so we know where to cut. All right. Moved a little. There we go. Okay, so we've done that with our marker pen. And you will be getting in your kit a small curved scissors that we can cut this opening out of. Now with this one piece appliance, you're going to have to pull out the backing because we don't want to cut that. You're going to start just in here, cut up to where your marking is. Just kind of curve around. Arts and crafts here. Cut the opening. And you can save this if you're for a guide, but like I said, you should be checking that. All right, so we've got that. I always like to rub my finger here, make sure there's no sharp edges. All right, so now we are ready to warm. Okay, now before we apply it, we still got our little tissue here. We're going to warm it up with our hands because that'll help it stick and contour to your skin. Okay, so 30 to 60 seconds, we're going to do that. All right, how you doing? Okay. All right,
Great as a patient.
okay. All right, so this is nice and warm. So now we're going to, your skin is nice and dry, clean and dry. We've got our opening cut. I'm going to fold this in half as you're doing it, and we're going to peel this off. But I'm not going to do it so I can use it again. That would peel off and you'd have your sticky, so kind of center it on the bottom. There we go. Start from the bottom and go up and around the stoma. Kind of gentle pressure. I like to roll right around the stoma. Gentle pressure to help it stick and tacky. And then all around. Okay. And then you've got it on. We've already closed the end of it. Make sure it's nice and tight. And then you're going to hold your hand there for about 30 to 60 seconds just to keep it warm and help it adhere to the skin. Okay, and then
Good.
you're ready. We can see your stoma with this clear thing, and everything still looks good. All right. Thank you.
Hooray.